We will discuss about Parkinson's disease and how Ayurveda offers an alternative and interesting line of approach, not only in diagnosis but also treatment. Now, Parkinsonism is a general term that refers to a group of neurological disorders characterized by movement problems, and we are quite familiar with Parkinson's disease, in which we see tremors, slowness of movement, bradykinesia, as well as stiffness. And under the category of Parkinsonism, there are many number of disorders. There are still challenges in, clearly classifying them. Parkinson's disease is also very difficult to diagnose in the earlier stages. And there are different presentations like atypical Parkinson's disease, Parkinson's plus, and there are also, early onset Parkinson's. So these syndromes tend to progress more rapidly than Parkinson's, like Parkinson's plus, and there are additional symptoms like early falling, dementia, or hallucinations, and they do not respond, or they don't respond well to levodopa therapy. So the thing is that Parkinson's is not just a simple straightforward presentation. There are many ways in which it presents, so there are some diagnostic challenges even in modern medicine. But if you were to go by definitions, Parkinson's disease can be defined as a neurodegenerative disorder that predominantly affects the dopamine producing neurons in a specific area of the brain, the substantia nigra, and symptoms develop slowly and over the years. The classical features of Parkinson's are bradykinesia, which is slowness of movement, tremor or shaking of limbs, hand or fingers, rigidity, an impaired posture or balance, loss of automatic movements, changes in speech, and difficulty in writing. So all of these symptoms may be present in different degrees of severity and presentations in different patients. So let's now look at the modern understanding of Parkinson's before we try to understand what Ayurveda offers in diagnosing Parkinson's disease, and also what new discoveries have been made in modern medicine which is helping us to get a better understanding of Parkinson's. Now, all the symptoms that we described may not be seen in all cases of Parkinson's. So generally, if there is a combination of slowness of the movement, tremors, and rigidity, one will strongly suspect Parkinson's disease. At this point of time, the whole focus of understanding the pathology of Parkinson's is based on what happens in the brain, especially in the area called substantia nigra, that leads to the deficiency of dopamine in the body. The sad news, even today, we do not really have a very effective treatment for Parkinson's. So what is available is only management of symptoms, and this could include medication as well as surgery, and also some lifestyle modifications, getting more rest as well as exercise. None of the available medicines can bring about a cure, although they can control the severity of the symptoms. So let's look at what are the medicines that are currently used, because it has been understood that Parkinson's disease is caused by deficiency of dopamine in the brain. The obvious logical solution is to supplement the body with dopamine. Now, dopamine cannot cross the blood-brain barrier, and that is why we administer L-dopa, which is the precursor of dopamine and which can enter the blood-brain through the blood-brain barrier. And that has become the medication of choice, the frontline medication for controlling the symptoms of Parkinson's. So the L-dopa works when the brain cells convert it into dopamine, and then the dopamine is a chemical that the body produces which enables the body to move, and that is why when there is a deficiency of dopamine, the movements of the body are affected. And It's just that people with Parkinson's do not have enough dopamine in their brains to control their movements. So without enough dopamine, patients cannot, have full coordination and control over their movements. So another problem is that levodopa also, if we give it alone, it gets converted into dopamine before it reaches the brain. And then, it acts peripherally in the body and also produces unwanted side effects like dyskinesia. So we also need to ensure that levodopa stays as levodopa until it reaches the brain. And so levodopa is mixed with another drug called carbidopa. So carbidopa ensures that levodopa is converted to dopamine only in the brain and not outside, so that, and also that it doesn't lead to dyskinesias. There are other medicines like safinamide. So this is given when levodopa and carbidopa fail to work. Then there are dopamine agonists which simulate the action of dopamine, because all these medicines in the long run lead to tolerance, and they don't show any effects on long-term use, and that is why alternatives need to be used. So now this is the understanding today, and these are the solutions that we have, and I would like to show some clinical experiences in the management of Parkinson's. Here is a patient who was brought to the hospital in a completely bedridden state with involuntary movements, the pill rolling tremor, and then in the course of Ayurvedic treatment we can clearly see how there is definite improvement in his movements. The patient who was mostly in the bed begins to stand up and tries to walk, with the help of a walking aid. And in the beginning, he's just learning to keep himself erect and stable, but cannot walk without support. And eventually, at the end of the treatment, we can see him walking without any physical support. He's able to walk on his own. So this is a very interesting reversal of the clinical presentation of Parkinson's that was achieved with just Ayurvedic treatment. Ayurveda could be a promising alternative for better management of Parkinson's, and I want to put some initial thoughts based on clinical experience on how we could go about outlining an alternative approach, which also involves an alternative model of understanding, a pathological model for understanding Parkinson's disease. So the problem with all modern medicines are that they have risk of side effects and they can only mask symptoms. And recently some studies have also pointed out that even when symptoms are masked, the disease progresses. There is no way modern medications can even arrest the progress of the disease. The disease continues to progress. The medications control the symptoms for some time. And when one medicine becomes tolerant, you try another. And after a point, none of these medicines work. So the renowned neuroscientist Dr. V.S. Ramachandran recently recommended, that Ayurveda could be a better alternative to Parkinson's disease, and he has even expressed interest to study Ayurveda and its role in Parkinson's disease, with Ayurvedic experts in India. Now his interest is that Ayurveda could offer solutions with fewer side effects and better clinical outcomes. And Dr. V.S. Ramachandran is a famous neuroscientist. He has written very interesting books like Phantoms in the Brain and such other works. But if you look at what he has found of potential in Ayurveda, this is a herb called Mucuna pruriens, which has been in the limelight for quite some time now. The reason why Mucuna pruriens is interesting is that this is a natural source of levodopa. And this could be an alternative to the synthetic L-DOPA that we give, as part of modern care. So Mucuna pruriens is also not really a novel solution. Actually, it only means that we are replacing synthetic L-DOPA with, a natural source. So will it really create a big difference? In fact, one of the biggest challenges in using Mucuna pruriens is that it's very difficult to standardize the quantity of levodopa present in Mucuna pruriens. So it's very difficult to adjust the dosage when you give it to a patient. And then there are many unanswered questions because Mucuna contains many other ingredients. How much of L-DOPA is actually bioavailable? And although many interesting studies have shown quite a bit of promise, clinically it's still not established that Mucuna can be an alternative or substitute for L-DOPA. So I want to go beyond this whole business of L-DOPA. We are not going to discuss about synthetic L-DOPA or even L-DOPA in Mucuna. And we are looking at a totally different angle to this disease, Parkinson's. And in fact, I am now inviting you to completely, shift from the brain to the gut of the patient. It appears even through modern research and even in Ayurveda, that is what we understand, that the origins of Parkinson's may actually be in the gut. And what happens is in the brain is only the tip of the iceberg. So if we want to reverse the disease, then perhaps the attention has to shift from the brain to the gut. So as long as we are focused only on L-DOPA or dopaminergic neurons and the substantia nigra in the brain, we will be only conjuring, solutions that are just effective to control symptoms, but not really reverse, not have a disease modifying effect. So here I want to talk about some new findings. There is a research has revealed that certain interesting things happen in the brain of the patients who present with Parkinson's disease. There is the presence of an abnormal protein, excessive accumulation of an abnormal protein called alpha-synuclein in the brain regions of patients affected by Parkinson's disease. So this is a misfolded protein, alpha-synuclein, which accumulate in the cells of the brain. And as more of these proteins begin to clump together, they cause the nerve tissues to die off. And so a lot of dead brain matter known as Lewy bodies are produced. As the brain cells die, they impair a person's ability to move, think, and even regulate the emotions. So this is beyond, just the lack of ability to produce dopamine. What's interesting is the misfolded alpha-synuclein protein accumulating in the brain and leading to the damage. So this is what really brings us to this question of whether Parkinson's begins in the gut rather than in the brain. Because a number of studies in recent times have demonstrated, and it all began in 2003 when the German neuroanatomist 𝐻𝐿 demonstrated that the deposit of alpha-synuclein happened in the part of the brain of Parkinson's patients that control the gut. So he was the first person to show a connection between the pathological changes that happen in the brain of Parkinson's patients. It could possibly have a connection with the gut. So at Johns Hopkins, there was another scientist, 𝐻𝐿 𝐶𝐿, who observed that the appearance of these neuron damaging proteins is consistent with some early symptoms of Parkinson's disease, which include constipation. Now this is very, very important, that it has been observed, and I have also seen this in all my patients of Parkinson's. We can see almost all of them have constipation as a major symptom, and it has been observed even by modern clinicians that constipation may start even 10 years before the manifestation of the disease. Now, so constipation is just an indicator of some pathological changes that are beginning to happen in the gut of the person. So now we know that, let's recapitulate. We know that dopamine deficiency is what causes Parkinson's, and this happens because of damage to neurons in the substantia nigra. And then we brought in this interesting finding that it's a misfolded protein, alpha-synuclein, that causes the damage and causing the brain to lose the ability to manufacture dopamine. And then we understood that this accumulates in a place in the brain which controls the gut. And now Parkinson's patients have constipation and disturbances in the gut much before Parkinson's developed. So this led to scientists trying to explore and find out if there is really a connection between the gut and the brain, and they were able to establish that this misfolded alpha-synuclein protein could actually be traveling from the gut to the brain through the vagus nerve. So the vagus nerve connects the stomach and small intestine into the base of the brain. So what they did was they took 2 groups of mice and they injected misfolded alpha-synuclein into both the groups. In one, the vagus nerve was intact, and the other, the vagus nerve was removed. And they found that the alpha-synuclein moved to the brain only in the group of mice in whom the vagus nerve was actually, removed. So this shows that the misfolded alpha-synuclein actually travels from the gut of the patient into the brain. Now what are the other events that may be leading to the misfolding of the alpha-synuclein? And this is where the gut microbes come into play. I mean, the microbes are almost like our ancestors because they are the first forms of life, and we have been in constant touch with our own ancestors. We are still living with them. In fact, the estimates show that we might even be outnumbered by the number of bacteria that live in our body. And the balance of this microbiome or bacteria is essential not only for our gut health but also the health of our immune system and even our mind. So many studies have shown that there are some aberrations in the gut microbiome of individuals with Parkinson's disease, and that transplanting fecal microbes from patients into rodents who were already susceptible to develop Parkinson's worsens the motor symptoms of the disease. And it also causes more aggregation of misfolded alpha-synuclein in the brain. So now it is quite clear that the gut microbiome it's becoming more and more clear that the disturbances in gut microbes is actually creating the condition for the misfolding alpha-synuclein and also its accumulation in the brain. So it is now being hypothesized that the microbes that go out of balance could trigger a process of inflammation in the gut, and this could be the underlying cause for Parkinson's disease. So we have come all the way down from the brain to the gut when we understand the concept of Parkinson's. Now in Ayurveda we have the concept of Udavarta, which means the upward movement from the gut, and this is the most interesting part of our discussion. For centuries Ayurveda has considered the gut, especially the lower intestines, to be the primary seat of Vata. So the upward movement of Vata is known as Udavarta, and it is considered to be an underlying pathology in many diseases. And what we are seeing here is that the symptoms, the improvements that we saw in the Parkinson's patients whom we demonstrated now, has all happened by just treating the gut of the patient. When we correct the gut by giving medications, these Agni, which will cause anulomana of the Vata and especially the Apana Vata, and this gives very quick responses and results in clinical settings than just the administration of mucuna pruriens, in addition to levodopa. In fact, we found that if we also combine both mucuna and levodopa, there are discomforts and unwanted symptoms that come, side effects of the medications. So even without looking at levodopa, by correcting the gut function, we are able to bring a lot of functional improvements in Parkinson's disease. So patients in different stages of development of Parkinson's disease were followed up closely to see improvements in clinical presentation with Ayurvedic treatment and the functions of Vata in the lower gut. And in all patients, constipation was found to be a cardinal symptom, and the clinical improvement has been seen to be directly proportional to the improvement observed in constipation. All of these patients become worse. You can clearly see this clinical correlation. When their bowels are disturbed, their symptoms are also getting worse. So what Ayurveda advises here is a bottom-up approach. Compared to the top, the entire focus on the brain, we are now moving from the gut to the brain. And we know that there is a gut brain, and the gut brain seems to be also controlling the brain, the brain inside in the head region of our body. And probably this is the reason why Ayurveda always maintained that the gut is the seat of Vata, and that is from the gut that the entire Vata system is controlled and regulated, and which is why perhaps Vasti became the frontline treatment of Vata imbalance. And this is a result that we see also in Parkinson's. Once we cleanse the gut and once we ignite the Agni, and when we give Vasti, is a major treatment that has been given in these patients, we see that there is a very good improvement. So once the gut is cleansed by first Deepana Pasana, Snehapana, then Virechana, because it causes Anulomanathum, and then Samsarjana and Agni Deepana, and then we give the combination of Anuvasana and Niruha Vastis. And once this phase of treatment is completed, the patient is already improved significantly from a clinical point of view. And then we go to the top. We do treatments like Nasya and Shirovasti in the last phase of treatment, and this is how the patient is stabilized. So by this time, we would be able to reduce the dependence of the patient on modern medications, not only L-dopa, Syndopa, but also other, psychotropic medicines that are given for hallucinations, for depression, and even for sleep. So this is what we would characterize in Ayurveda as a bottom-up approach. So we would need to then understand how Ayurveda treatments really could be working. We can only kind of guesswork at this time what really happens. We can only have conjectures, hypothetical assumptions. But it appears that Ayurvedic treatment is in some way influencing the misfolding of alpha-synuclein protein as well as its migration from the gut to the brain. So if we are able to control the Udavarta, which means the upward movement of the misfolded alpha-synuclein, maybe through Ayurvedic treatment it is becoming reversed and arrested. And perhaps Ayurvedic treatments are also influencing the composition of the gut microbes in a Parkinson's patient, thereby completely changing the whole development of the disease. And we need further studies to be able to understand. We are clearly seeing clinical outcomes, but we need to do further research to really establish the mechanism of how Ayurvedic treatment works. And for this we need very rigorous documentation from actual cases of Parkinson's disease that are treated with Ayurvedic interventions. So the first step in Ayurvedic treatment is to make the gut move. The downward peristalsis of the gut is activated. So we have given medicines like Gandharvastadi Kashayam with Gandharvastadi castor oil and Hinguvajadi Churnam. These are medicines that work against the Udavarta of Vata, and it also ignites the digestion as well as stimulates the movements of Apana Vata. And in the second phase, what we do is to release Vata, the mild Udvartana with herbal powders followed by oil application, and Dhanyamla Dhara helps in releasing the Vata. So we do very little Udvarthana with Kolakulatha Churnam, Sahachara Tailam. And in the second stage, the body cleansing of the body is done. Snehapana is administered to prepare the patient for purgation. So Kalyanaga Ghridam, because there are a lot of psychological symptoms in the patient, it's administered for 7 days, and then Snehana is achieved. Many physicians have reported that administering Kalyanaga Ghridam in coconut oil is also beneficial. This is followed by Virechana, and Snigdha Virechana is preferred over Ruksha Virechana because of the long history of constipation. And then Ardhamatrika Vasti is given for stabilizing Apana, and a combination of Niruha Vasti and Anuvasana Vasti is given. And this helps to regulate Apana Vata and also to normalize the gut function. And then once the gut is taken care of, we are already seeing a lot of clinical improvements. And after the gut function has been corrected and the rhythm of Apana Vata has been restored, Nasya is done to cleanse the Shiras. And Anutailam is a good choice. Later, Chirabala can be used after the cleansing has been achieved. And then in the last phase of the treatment, Shirovasti is given for using oils like Chirabala or Sahajaradi. These are the options. And this is how the whole treatment is administered. And this is how we found the results that we saw in those patients, that we discussed about a little while ago. Now, what can 𝐶𝐜 or 𝐜 do in this whole scheme of Ayurvedic treatment? So, we are strongly proposing that when patients come to Ayurvedic physicians, they are already on levodopa or dopamine agonists. So, 𝐶𝐜 could be used as an alternative to wean off the modern medication so that there won't be any withdrawal symptoms. While we do the classical Ayurvedic treatment, we could actually slowly, stop the modern medications and then introduce the 𝐶𝐜, and we have found that 𝐶𝐜 in water is more effective, and sometimes we can add for the psychotic symptoms of hallucination, we can add herbs like Shankhapushpi, Ashwagandha or Brahmi also, so that it also supports the mind of the patient. So let's now then come to the critical question, what then is Parkinson's disease in Ayurveda? We are often using the terms like Kampavata to label it, but clear descriptions are not available. So considering the symptoms, bradykinesia, rigidity, tremor, posture and gait, we need to ask, because it's more important to understand the whole pathological process from an Ayurvedic viewpoint rather than, just give it a name. So what is it really happening? Is it an increase of kapha, or is it a kapha vata situation, or is it an avarana of vata? We do know that there are degenerative changes happening in the brain, which is dhatu kshaya. So definitely it is an increase of vata due to kshaya of the medo dhatu. But then it also indicates that there could be mechanisms like avarana or rodha also involved. So these are the points that we discuss when we try to understand how Ayurvedic treatments work. It has been found that avarana treatment of vata, if we are doing some initial treatments to remove the avarana or blockage of vata, it is giving good clinical results. So doing a little bit of udvarthana in the beginning and then doing anulomana of vata. So this is the sequence. Treatment for avarana of vata in the beginning phase, and then anulomana. First after clearing the avarana or avarotha, then you do anulomana of vata, and then brahmana and shamana of vata. And the whole process starts from apana vata and ends with prana. So we can say that the Ayurvedic approach to treatment of Parkinson's is an inside out and bottom up approach. So this is a brief overview of how we can look at Parkinson's disease. This is just based on clinical experience of treating with some Parkinson's patients. In clinical practice, So the main points that were discussed in this lecture is this emphasis on understanding the role of the gut in the, not only in the development of Parkinson's disease, and how by intervening in the pathological changes that happen in the gut, we are able to create a more sustainable and disease modifying effect in the management of Parkinson's disease. Definitely more research is needed to establish a well-defined protocol that could be more widely applied for the management of Parkinson's disease. Thank you.